Good evening, everyone, and thank you for tuning into the Toronto News Channel. My name is Caite Pelaia. Today, we will be talking about a new initiative that is set to transform the way that patients' voices are heard in the healthcare setting. A group of nursing students from York University took it upon themselves to create a change strategy that focuses on improving advocacy and overall patient care. What started out with a simple checklist and diagram is making waves in the healthcare system. Advocacy has been said to increase access to care, quicker response times, better patient care, and increased communication between the care team and patients. Advocacy is not only about speaking up for your patient's wishes, but also entails participating in intercollaborative dialogue with the care team, being present with the patient to empower and educate them of their options, as well as ensuring that personal judgments and biases are not conveyed to the patients. Advocacy in the healthcare team has been an issue, and this new initiative will improve patient satisfaction and how care is received. With more on this topic is Caite Logan at the York University campus.
Thanks, Katie. As mentioned earlier, the students have created a Check for Advocacy document, which includes both a checklist and a diagram and outlines the steps that nurses should follow in order to advocate for their patient. These steps include patient knowledge, bracket, assess, plan, share, act, and reflect. The checklist describes each step as well as it provides questions that the nurses can ask themselves while doing each step in order to ensure that they are following it properly. Whereas the diagram is a visualization of the steps necessary in order to advocate for your patient. This can be put up in hospitals just like the hand hygiene document. This way, both the nurses can see it, the patients can see it, and their families as well can see it. The students decided to create this in two different forms in order to appeal to two different types of learners. The checklist appeals to those who like to learn hands-on and to read the instructions in order to do something, whereas the diagram appeals to those who like a visualization of how to do things. Now we have some clips from nursing students themselves who have been able to use this tool and their input on it and how it is useful in the hospital.
Hi, I'm Alyssa, student nurse from York University. I think that an advocacy checklist or cycle will help the healthcare facility because it will allow us to, create better therapeutic relationships with our patients and work together as a team better to ensure that they're getting the best quality care as possible.
Advocacy is a huge responsibility for all nurses, and I think the checklist will give us something to follow when we don't know exactly how to approach it or when we're not sure where to start.
Well, you heard it here first, folks. The way that patients are being advocated for are making huge changes in 2018. Sending it back to you, Katie.
Thanks, Caite. Wow, it sure is great seeing future nurses fighting for change for their future patients. At least we know someone will be there to advocate for us when we don't have a voice. Also, don't forget to check out the students' Pinterest board to learn more about advocacy. That's all that we have for today, folks. Join us next week when we talk about whether or not you should vaccinate your children. Good night.